As was already mentioned, I'm the Chief Science Officer at Atrium and Vice President of Scientific and Regulatory Affairs for our professional brands, including Douglas Labs. That means I'm a paid employee, to be clear. I'm a researcher by training with a PhD in nutritional immunology. Not bad, Carla. That was pretty. You got that out. It's not easy to get nutritional immunology, that phrase, out when you're in front of an audience. So I'm not a clinician. Nothing I say today should be considered medical advice. This is very much a research-based educational session for educational purposes only. So in my role, I have the awesome opportunity to oversee product development efforts for our professional product lines, as well as Carla mentioned, all the clinical research investments that we make globally. I work with an amazing team, this amazing team that you see here, of scientists and regulatory professionals, including PhDs, Masters of Science, registered dietitians, nutritionists, etc. I am not in the picture because I'm the one taking the picture, but actually Carla's in it, so our moderator, second one from the right, she's peeking there, so now you get a visual. But I just want to make a thank you to this team, really, for their tremendous efforts. I'm extremely proud of the quality of our products and the level of research investment that we make as a company, both to develop and substantiate the safety and efficacy of our products, but also to advance the state of nutrition science in general. That's one guiding principle that I've certainly put in place and we've followed over these past almost 10 years when making investments, was to make sure that we are always not only looking at product research and understanding our products and their uses, but also answering academic questions along the way. I have the opportunity to share just some of that work with you today as relates specifically to systemic enzyme therapy. So our agenda, I'll start with some background, history on the origins and uses of systemic enzyme therapy. It's interesting, so it's a good place to start. And I do want to give some global perspective. Wobenzym is a global brand used all around the world. Also, I know we have a diverse audience in terms of countries represented, certainly the US, and in particular, I know we have Canadian colleagues as well on the line. So it makes it a little bit more complicated, but I do want to take the time to comment on the positioning and availability of different enzyme therapies in these different countries, and in particular focus on the US and Canada. We'll discuss mechanism of action. I selected some clinical trials to detail a little bit for you, some of the most recent ones. We'll end with some of the specifics in terms of indications, directions of use, and some additional resources. So starting kind of 30,000-foot view, what's the definition of systemic enzyme therapy? What does it mean? Systemic enzyme therapy is a combination, is defined as a combination of proteolytic enzymes, so protein digesting enzymes, from both plant and animal sources, in combination with bioflavonoids, in particular rutin or rudicide. And in some formulas, there are additional lipase enzyme and amylase enzymes, but at its core and consistent across systemic enzyme preparations, you find the combination of proteolytic enzymes and rutin. The concept of systemic enzyme therapy was really developed and pioneered by a gentleman named Max Wolf, Dr. Max Wolf. He was Austrian by birth, but spent much of his professional career in different places, including the United States, and developed the concept of systemic enzyme therapy with a colleague at Columbia University by the name of Helen Benitez. So it's actually this union of two minds and two names of Wolf and Benitez that led to the development of Wolf-Benitez enzyme therapy, which later was commercialized as Wobenzym. So you can see the origin of the term, and really it helps to understand how Wobenzym as a brand is really the first name in a broader category called systemic enzyme therapy. Some images there. It's kind of interesting to see, images of the pharmaceutical company where Wobenzym was developed in the 1950s and the current facility in Berlin on the right today. Some images of enzyme sources as well, and the Japanese pagoda tree flower as the source of rutin. Today, the process of Wobenzym development is a fully integrated supply chain with enzyme preparation facilities in Argentina, manufacturing Berlin, and marketing headquarters in Munich and Prague. So, as I said, Wobenzym is a global brand. It's a registered OTC drug in, I believe, 18 countries, starting in Germany and extending across on Eastern Europe as well as into Central and South America. Systemic enzyme products in general are regulated as dietary supplements in North America, but Wobenzym is a drug in the countries you see here, including, I have a list, Germany, Austria, Finland, Greece, Switzerland, the Czech Republic, Bulgaria, Hungary, Kazakhstan, Latvia, Lithuania, Moldova, Romania, Russia, Slovakia, Ukraine, Venezuela, Ecuador, and Mexico by last count. So it is a drug product in much of the world, although you see in North America it is a dietary supplement, or in Canada, a natural health product. I think it's really important to recognize that drug history of Wobenzym and its use throughout the world, because it does help us understand how a food supplement in North America can be based on such an extensive history of clinical research. I would go so far as to say that Wobenzym is probably the most studied dietary supplement or natural health product on the market, at least as a finished product and not just as an ingredient. And this history is why. So also ongoing research was and is a requirement in marketing authorizations that allow Wobenzym to be sold as an OTC in these other countries. So it's part of the reason we see such an incredible history in research investment. And we continue to invest heavily in furthering our understanding and the clinical applications of systemic enzyme therapy. So as a global product, systemic enzyme therapy is regulated differently in different countries. Frankly, there's probably as many different indications of use or most popular uses for Wobenzym as there are countries in which it's used. It's a very broad-acting product and historically has been used across a number of indications. And if we pulled use by country, the number one indication would differ by the country in which it's used and just the tradition of its use in that country. And Wobenzym really does have a storied history and a very broad brand recognition. It's really interesting, but I mean, Wobenzym as a product and as a brand is the #1 selling joint health pill in Germany, period. So that's across, it's an OTC drug there. So across all OTC joint health pills, Wobenzym is the #1 selling product in that category. So kind of remarkable, I think, from our perspective, as we tend to view Wobenzym as a dietary supplement and that has a weird name. It's been around for a long time, but it's always been more of a best-kept secret type of product with a following among naturopathic physicians, integrative or functional medical practitioners who are, quote, in the know. So all of you that take the time to get this additional kind of education like we're doing today. I wanted to, before we get too far, I wanted to address something really head-on. I think before we can get into efficacy, it's worth spending a minute on mechanism, because it's probably the area in systemic enzyme therapy that stimulates the most questions or confusion. Second probably only in the world of Wobenzym as to whether there's an E or not at the end. There's not, by the way. So if there's one takeaway today, it's maybe how to spell it. So no E on the end. But in systemic enzyme therapy, I think the best resource broadly to address it and its mechanism that I can suggest is this particular paper by Gerhard Lorkowski that came out in 2012 which helps understand the mechanism at least partially responsible for the clinical effects of systemic enzyme therapy. This paper, I will tell you, is highly technical and kind of a tough read. I tried to go back and reread some of it today in preparation, but it's very, very well done. It summarizes a large number of studies that clearly demonstrate that small amounts of proteolytic or systemic enzymes are indeed absorbed, something we didn't always understand, which results in increased enzyme levels and proteolytic activity in the blood that can be measured, and that these intact enzymes bind quickly and entirely with antiproteases to form active immune complexes that promote a healthy, balanced immune response. So that's in a nutshell. As I go, I mean, there are a number of papers that I'll be referencing. All of these, or almost all of these, at least the more recent ones, including this one, full text studies, if you're interested, are available. So if you can't find them on your own, one resource is the Atrium Innovations website. If you went to atriuminnovations.com and then atrium-innovations.com, then to the research page, and there's a page on publications. It's a fully searchable page, and you can pick a search term like Wobenzym and bring up all the papers that are relevant. So much of what I'll reference today would be available there, or otherwise we'd find another way to get you a copy of these works. So I'll say it again. I summarized it kind of in a nutshell just now, but to say it again, proteases, according to this review work, proteases we now know are in fact absorbed intact in very small amounts. They also probably have some level of mechanism in interacting with the intestinal epithelium, but a little less well developed. Proteases exist in the blood at very low levels, but not levels that aren't physiologically relevant or similar to levels you find for certain other nutrients. Proteases exist only transiently as free proteases in the blood. They become very quickly bound to circulating antiproteases. You can't have protein-degrading enzymes floating around at will. So the typical mechanism is to bind proteases in the blood very quickly. Antiproteases are produced in vivo, in circulation, and then are available to bind any proteases that are either developed de novo in the body itself or absorbed from orally. This leads to also increased proteolytic activity in the blood, which can be measured. So oral enzyme consumption increases proteolytic activity in the blood, which can be measured, and the increased plasma concentration of antiproteases. So not only are there circulating antiproteases in the body, when oral proteolytic enzymes are introduced, the liver produces more antiproteases, so the level of antiproteases is increased. Proteolytic enzymes are entirely bound to circulating antiproteases, and that complex, protease to antiprotease complex, is what's involved in the immune response to injury and participates in the natural inflammatory response and resolution of inflammation. So just a few figures from that actual paper from Dr. Lorkowski. I think it's important to show this to illustrate the dose-dependent increase in enzyme concentration in the blood, which is really mirrored by an increase in proteolytic activity. So if you look at the figure, this is 2 different doses, either 4 or 8 tablets given 4 times a day over a period of time. You see along the x-axis, you do see an increase in serum concentration. That would be the solid icons, while the product or enzymes are being supplemented orally, and then it resolves after the cessation of enzyme intake, which is the vertical line in the middle of the figure, starts to go back to baseline. And corresponding quite directly with oral intake and serum concentration are the open icons, the triangle and circle, 2 different doses showing corresponding hydrolytic activity. I don't think directly from Dr. Lorkowski's paper, but just a few more examples from some of the internal data that are available. This is similar, but demonstrating more the dose response. This is actually consumption of the enzyme bromelain from pineapple at 2 different doses. Actually, specifically, this is the product Wobenzym N, and you can see, again, a dose-dependent difference in serum concentration of bromelain, which could be measured through an immune assay. Also, this one I also wanted to include, just showing some inter-individual variability, you know, the concept of a responder versus a non-responder. So here you have 2 different, you know, the data points from 2 different subjects given the same dose of Wobenzym N, and you clearly have someone who's responding and another person who has minimal response to oral supplementation with enzymes. So, you know, what I don't have, unfortunately, are any studies tying response to enzyme supplementation to the clinical outcome, although if that's what you're thinking, I agree that would be a very nice addition to the data that we have available. Just to illustrate this a little differently, the binding of in vivo or oral proteases to their anti-proteases results in a conformational change. Think back to biochemistry classes and the, you know, how enzymes work. So you have a conformational, so you have the circulating anti-protease, which is illustrated here structurally as almost like a double X in circulation. You have enzymes present. Those enzymes bind to binding sites that are exposed in the freely circulating anti-protease, but upon that binding, you have a conformational change in enzyme structure, where you see it to the right, where the anti-protease then folds in such a way that exposes new binding sites that are binding sites for various cytokines. So these complexes, you know, once you have an enzyme bound to an antiprotease, they really act as cytokine scavengers to restore cellular immune balance. This is a natural process. It goes on in the body all the time, and particularly in response to an immune response as part of the clearance mechanism. So really, systemic enzyme therapy is not introducing something novel to the body, but it is promoting something that naturally occurs by providing additional oral enzyme, by upregulating the production of antiproteases, and thus providing more of these cytokine scavenging protease, antiprotease complexes to clean up, if you will, following immune response, and thus restoring balance and homeostasis to the system. So with a broad mechanism of action like that, one might expect a diverse set of clinical indications, and indeed that's the case. Systemic enzyme therapy, as I said earlier, has been studied for and used for a variety of different clinical indications around the world. They're used in promoting joint health, used in post-surgery and post-injury. More recently, we've been looking at cardiometabolic implications, used very broadly in supporting gynecological health, particularly in Eastern Europe, Russia, where the product is very well known in that category, breast and tissue health, thyroid, urinary tract health, etc. Transitioning now just a bit from the broader concept of systemic enzymes to more specifically the Wobenzym formulas, I thought we should tackle this a little bit before I get into the studies so you know what we're talking about when I mention perhaps different formula names or product names. There are 3 Wobenzym formulas on the market in North America today. They're shown here. Wobenzym N, the classic formula, if you will, that's been around, was historically a product available in Germany. A lower active potency, and it's typically used at 6 tablets a day, but up to 12 or 15 or even more per day under supervision of the healthcare practitioner. So these are tiny Skittle-like tablets that are used kind of foreign to us, certainly, but it's something that's kind of the convention for this particular product and has been for decades. Very small tablets that you take a relatively large number of them. Wobenzym PS, or professional strength, is a higher enzyme activity per tablet. such that 6 tablets, this isn't really to scale exactly in what I'm showing you, and obviously the size of your screen would indicate that, but these are small tablets also, and 6 of them provide the clinically studied dose. So almost all of the studies that I will discuss today use the Wobenzym PS formula at 6 tablets a day. I think there are a few at 12 tablets, and I'll be sure to point that out. Wobenzym Plus is a newer option available in North America, which is the exact same formula from an active component perspective as Wobenzym PS. They are equivalent products, but it's dosed differently so that slightly larger tablets are available so that you only have to take 4 of them a day to achieve the clinically studied dose. And just to give one example, this is a supplement facts from the Wobenzym Plus. Just to really show you, this is the combination of a plant and an animal proteolytic enzyme source with the bioflavonoid rutin, as I said. This is a simple formula, but total proteolytic activity in Wobenzym Plus is the highest per tablet, and the serving size of 2 tablets, it would be 2 BIDs, so 4 tablets a day to achieve the clinically studied dose. I thought in terms of getting into actual studies, maybe I'd start off with some really old stuff, just to, because I think it's interesting, it's worth showing. Really, I think mostly the history of safe and effective use of enzyme therapy across a large number of men, women, of all different ages. So this one is actually, these are actually data from Wobenzym N usage, which is perhaps I think the only data I'll show today on the Wobenzym N formula, the classic formula, showing across, this is retrospective trials, use of Wobenzym N across different populations, those using for post-injury, for joint support, immune support, or vascular health. You see a very large number of subjects in total in this particular assessment, just a sampling, obviously, but getting data on about 2,500 subjects and their clinical experiences. Again, looking at men and women, and again, a very a diverse range of ages in which systemic enzyme therapy has been used. And as I mentioned, we maintain a tremendous body of research in support of systemic enzyme therapy and Wobenzym in particular. We have over 200 product-specific clinical studies and reports on file. This table is just a snapshot of a selection of what I think are some of the notable ones and of interest to us. And a few of these I will discuss in a bit more detail for you now. I thought getting into the clinical trials, I would start with this paper by Wolfgang Bolton and colleagues, published in 2015 in the journal Arthritis. These are results from a randomized, double-blind, placebo-controlled, and comparator-controlled trial on the Wobenzym PS, 2 tablets, 3 times a day, so 6 daily, versus a comparator as a positive control, a comparator OTC drug versus a placebo. Full disclosure, I was an author on this particular paper. So this was a German study done by Dr. Bolton. The reports were in German. And to bring that to a level of, I would say, satisfactory writing, and to get third-party professional statistician to review, analyze, and report on the data, I was able to be involved in this to get it ready for peer review level and publication in English. So it was a great opportunity for me and good experience, but I was able to really dig into these data and understand this study. And I think what's, the reason this study is so significant and why I start with it is that this particular study design was excellent in that 150 subjects across these 3 groups, over 12 weeks duration. This is one of the only studies we have comparing enzyme therapy to a comparator and a placebo in a single trial. So historically, I can tell you, most studies that exist on Wobenzym, particularly in the area of joint health. Compare Wobenzym to a comparator drug, so standard of care, if you will, and that follows its use as an OTC. You see some of those kind of comparator trials here as well, even a resurgence of that idea. But really, I think, especially in an area like joint health, where you do have a good bit of placebo benefit. You can see even in this particular study, if you look at the table in the upper right, there was a 16% improvement in Lecaine index, so that's the overall functional score in these subjects, so a 16% improvement in the placebo group. So somewhere around a 15 to 20% improvement when you're reviewing something like pain and joint comfort, flexibility, and use of a joint. That's not uncommon. So differentiating, placebo effect out of the trial effect can be somewhat tricky when you don't have placebo present. So a lot of trials have been done on Wobenzym, systemic enzymes, compared to standard of care, showing what is reported as non-inferiority, meaning that Wobenzym works just as well as the standard OTC medication for that category, but without placebo control. This trial, to me, is almost like the Rosetta Stone study that really links together our vast experience in comparator-controlled trials with placebo-controlled trials, because all of it is wrapped up into one study design and done very nicely. In addition to significant, so this particular study showed significant improvement in joint comfort with the Wobenzym group compared to placebo, and both Wobenzym and comparator had a similar level of benefit, so not statistically different between drug and Wobenzym, but both significantly more effective than placebo. However, what is not uncommon is that despite similar efficacy, we see less incidence of adverse events, primarily GI-related events, in the Wobenzym group compared to a comparator. So 7% of subjects in this controlled study reporting some adverse GI event, discomfort or something, versus 15% in comparator. Pretty common to see 15% or more with use of an NSAID versus Wobenzym at half of that. So also, I thought what was interesting about this study was in the use of rescue medication. So from a purely ethical perspective, subjects were permitted to use acetaminophen when they needed it. While the similar number of subjects reported using acetaminophen in all of the groups, similar number actually used it if you look at the table 4 to the bottom right. What was different is the median number of tablets consumed was significantly less in the Wobenzym group compared to the comparator group, and also significantly less than the placebo. And although it's 10 to 4, statistics-wise, the comparator group relied on acetaminophen as much as the placebo. So there was a clear clinical benefit here in terms of the subjects' reliance on rescue medication being reduced when they were using Wobenzym to manage their joint health. Very recent publication I wanted to share, an analysis performed by Dr. Michael Uberall, published in the journal Pain Research just in late 2016. This is really great in a meta-analysis of 6 comparator-controlled trials covering 774 subjects using Wobenzym PS at 6 tablets a day, 3 to 12 weeks, depending on the study duration. And again, looking at the typical Lecaine functional index, pain scores, as well as adverse events and laboratory parameters. So this is a nice statistical analysis to really look at when you take all of these studies of similar design together, and you increase the power that way, and you can really look at the benefit. Clearly in comparator-controlled trials, Wobenzym demonstrated equivalent efficacy to standard of care, but superior tolerability and safety profile. So we saw less adverse events, particularly GI-related, and very significant differences in terms of laboratory parameters of safety. Also, another very recent publication to share in the area of sports and recovery. This was in British Medical Journal Open Sport and Exercise just this year. Randomized, double-blind, placebo-controlled, two-stage trial looking in a healthy population of active adults, pre and post exhaustive exercise. The overall results demonstrating improved recovery of exercise-induced muscle damage and delayed onset muscle soreness, and an increase in maximal strength in the less strength-trained subjects, the endurance and general athletes. Just to be very clear about that, in the two different stages, there were slightly different study populations enrolled. Those that were more used to strength training, as you might expect, it's harder to see an improvement in a performance parameter like maximal strength if you're enrolling people that are at a higher baseline level. So those that were strength trained and more used to doing exercises like exhaustive leg lifts were less responsive on the strength aspect, but across the board, importantly, regardless of training style, all subjects benefited from a moderation, balancing biomarkers of immune response. So regardless of training level, across the entire study population, there was an improvement in immune biomarkers. Also in sports, but going back a bit to 1995, Ron and colleagues, there were actually a series of papers from this time looking at sport and recovery. This is ankle comfort and mobility, moderate swelling, and a length of time required to return to work or training following ankle injury. These were typically placebo-controlled trials. This one here from Ron, 1995, is an example. And in the figures you see an improvement really in both groups, because over time the placebo group is improving as well, but expedited recovery, expedited recovery in the Wobenzym treatment group. The improvement really here starting at, depending on the study, by days 3 or 4, but certainly by day 7, a differential improvement in the Wobenzym treated recovery group versus those on placebo. And next, finally, in terms of digging into recent studies, one that took us in a slightly different direction, looking into cardiometabolic health. This is from 2015 with our partners at INAF, the Institute of Nutrition and Functional Foods at Laval University in Quebec City, Canada. We went in a more exploratory direction with this study. We have a long history, just so you know, a standing relationship with this academic group at INAF at the University of Laval in Canada, as we've funded a comprehensive program on nutritional strategies and promoting cardiometabolic health. So within that umbrella program, we did look at the potential role of systemic enzyme therapy, and this was actually based on some very nice preclinical studies that were done in Russia in an animal model of metabolic syndrome that had demonstrated really remarkable results with Wobenzym. So this particular study was a randomized double-blind placebo-controlled crossover trial, very well done design with 24 subjects for 4 weeks, 6 tablets of Wobenzym PS per day, looking at markers of subclinical inflammation like cytokines, serum, CRP, etc. And the results did demonstrate a significant reduction in CRP and IL-6, particularly in men. The overall results in IL-6 reduction, just showing benefit, covered the entire study population, but it was really the results in men that was driving that response. And it's not the first time that the researchers have seen some sex differences in immune response that require further study. So it's really interesting for us to further look into differential responses to immune responses that occur. It seems to occur quite commonly in men versus women, and what some of those factors might be that are driving that. So to put all of that together, Wobenzym is the I'm going to say it again, the #1 joint health pill in Germany. I hope, even though it was very quick, showed some strong clinical research demonstrating that Wobenzym provides temporary relief from everyday aches and pains and muscle soreness, starts to work in as little as 7 days to promote speedy recovery following exertion. There are emerging data indicating potential role in cardiometabolic health, which is interesting. Enzyme therapy helps balance the immune system through the mechanisms we discussed, speeds recovery, and it can be used post-injury and post-surgery. When I started out, I said the topic requires that we take a global view, and I want to just disentangle that a little bit for you. This is actually the Wobenzym, some claims that are from the label as labeled on Wobenzym PS or Wobenzym Plus in the United States. Wobenzym is positioned to help maintain healthy joints, mobility, and flexibility, to temporarily relieve everyday aches, pains, and muscle soreness, and to assist in speedy recovery following exertion. Obviously, the claims and indications differ depending on the regulatory environment in which the products are sold. Wobenzym is clearly clinically proven with 50-plus years of research, and as I said, over 200 product-specific clinical trials and reports. Just to show the difference in Canada for our Canadian guests in the audience today, in Canada, supplements are called natural health, are within the category of natural health products, and the claims are reviewed and approved by the Natural and Non-Prescription Health Product Directorate. I hope I got that out right, NNHPD, of Health Canada, as per the license that's issued for each product. In Canada, Wobenzym is approved and used as a factor in ankle joint injury recuperation and to relieve pain associated with osteoarthritis of the knee and hip. This is actually a image of the U.S. label. I apologize, I didn't grab a Canadian one to show you, but it's very similar. You'd see French language in addition, but otherwise quite similar. Circling back to the 3 Wobenzym formulas available in North America, just to provide some quick snapshot of the chart. This is in some materials that are available to you as a practitioner on Wobenzym from Douglas Laboratories. We have the 3 different formulas here: Wobenzym Plus, the larger, slightly larger, they're still quite small, but slightly larger tablets, so that 4 tablets per day provide a convenient dose, and really positioning that for active lifestyle, given some of the sport and recovery benefits demonstrated clinically for Wobenzym. Wobenzym PS, professional strength, the tiny little round tablets, 6 tablets per day to provide the clinical dose, a higher potency, acute use. And then the classic formula of Wobenzym N, where, again, the recommended daily dose is 6 tablets, although more are used in certain situations under healthcare supervision for general wellness and the broad spectrum uses of systemic enzyme therapy. Just providing a bit more specifics on clinical uses of Wobenzym, how to use it appropriately. Enzyme therapies must be enteric-coated. This is essential for efficacy for systemic enzyme therapy. This is essential for the benefits and to minimize GI upset that can be taken when taking high-dose proteolytic enzymes. So Wobenzym and systemic enzyme therapy must be enteric-coated and must be taken apart from foods. So the labeling typically advises 45 minutes before a meal. You could also say perhaps an hour and a half after a meal. The product is intended to be taken on an empty stomach for maximum benefit. Again, both Wobenzym N and Wobenzym PS are labeled for 6 tablets per day. That can be 2 3 times a day or 3 twice a day. We do, again, see acute applications of 12 tablets a day under supervision for shorter periods of time to get benefit. And the Wobenzym Plus formula is a revised version of Wobenzym PS to allow for the clinically studied dose at just 4 tablets per day. There's extensive evidence that Wobenzym is better tolerated than positive controls used in clinical trials, standard of care. Adverse events are rare, but when they do occur, it's primarily GI upset. A lot of clinical trials have been around 2% on Wobenzym. I showed you one where there's as high as 7%. and typical is around 15% in comparator for the comparator. Although, I mean, based on adverse event reporting, et cetera, this is less in clinical practice. And the adverse events that are reported when reported are typically something like flatulence or nausea or diarrhea that would resolve with either taking the product appropriately apart from food or discontinuation. There are some contraindications of note, such as a known allergy to pineapples, papaya, pork protein, or any of the other tablet components, clotting disorders that may exhibit fibrinolytic activity, and we do make the statement not to use when pregnant, as that has not been adequately studied. Drug interactions include, out of abundance of caution, a warning against the use of enzyme therapy and Wobenzym specifically with blood thinners, Coumadin, warfarin. The Canadian label also lists a contraindication with other anti-inflammatory medications, as they've not been studied together. And there are some data from Europe suggesting some interaction between enzyme therapy and antibiotic, particularly increasing antibiotic efficacy. Definitely requires further study, but it is something that you might see in international literature, so I note it here as well. Resources available through Douglas Labs include this systemic enzyme support protocol that was developed by our longtime advisor, Dr. Joe Collins, who has extensive experience using Wobenzym in clinical practice. Again, providing some formula guidance in terms of label dosing, optional loading doses that can be used as well, and the specific attributes of each formula, as well as a summary of clinical objectives, support functions, formula recommendations depending on the clinical objective, and then references available for the study supporting those different indications. So in summary, and just to bring it to conclusion, Wobenzym has a long-standing history of use. Clearly, it's the pioneer in a category that it created called systemic enzyme therapy. The clinical emphasis is really in the area of healthy joints, mobility, recovery, emerging data in metabolic health, quite a bit of data in sports nutrition. We do know, at least in part, how systemic enzyme therapy works. The central mechanism is supporting the body's natural ability to balance immune response and balance cytokines by using a natural process that exists as part of immune clearance in the body. Clinical efficacy absolutely requires enteric coating and compliance to dosing and delivery times separate from meals on an empty stomach. Enzyme therapy is backed by a large number, more than 200 product-specific clinical trials and reports, and hopefully I've been able to express to you that we have a continued commitment to high-quality research in this area as well as other aspects of nutrition and wellness. So that brings me to a conclusion. Pass it back to you, Carla, if there are any questions or...
Yeah, great. Thank you, Barry. We do have a few questions. Thank you all on the line who have submitted questions asking Dr. Ritz about your questions about Wobenzym. This first question is, would you recommend Wobenzym Plus for someone trying to recover from knee replacement? That was from Tam.
It's a very interesting question, and what I can say is that we actually have more experience on post-surgical uses of Wobenzym in Central and Eastern Europe. So particularly right now in the Czech Republic and Russia, we are engaged. It's still somewhat in the planning studies, but working on a large clinical trial looking at exactly that. Certainly there's a lot of clinical experience in that area, but looking at sort of a post-replacement situations, whether it be knee or hip, and then the potential benefits of Wobenzym. So generally speaking, based on its mechanism of action and clinical experience, that's an appropriate use of Wobenzym. And yes, Wobenzym Plus or PS are appropriate. Again, the difference is really just the dosing size of the tablets. But it's actually an area we're continuing to investigate as well, and hopefully we'll have more specific data to that actual patient need.
Okay, and the next question is from Andy. This is, why were the 3 ingredients in the original formula replaced in the PS and the plus formula?
So the 3 original, you mean the, actually if I could show it, the core of trypsin, bromelain, and rutin continues through all of the formulas. So all of the formulas have that core of a plant-derived and animal-derived proteolytic enzyme and rutin. What happened was, over its long history, the formula got less and less complex in terms of the number of ingredients, but the proteolytic activity of the formula increased. So without getting maybe too detailed in it, way back in the original Wobenzym formula, there were actually a couple different sources of animal proteolytic enzymes as well as plant proteolytic enzymes. So you also see, for example, in some products, in addition to bromelain, you see papain from papaya. You see, in addition to trypsin, chymotrypsin, pancreatin as well, and even some non-proteolytic enzymes like lipase and amylase. It's really actually a consequence, to be very clear, of regulatory structure over time, more than anything else. So as a drug product in Europe with 8 ingredients or so, that's not typical, right? It's something we're all used to, seeing complex formulas, but over time, there's the convention that no, drugs are single-acting ingredients that have to have a single binding site and have a single activity, which of course is not the case for Wobenzym. But from a regulatory pressure, the formula went from more than that number of active ingredients to one of 6 active ingredients, and later to one of 3 active ingredients, to try to appease the idea that drug therapies should have less ingredients. Now, while that was being done, it wasn't just willy-nilly. There were studies done, and they were eliminating duplicative enzymes and ingredients and increasing the total proteolytic activity, which was believed to be driving the efficacy. So it was done in a thoughtful manner, but that's actually what drove its progression over the years. Today, just to kind of come back full circle, I can tell you, by having worked with the body of literature that it exists, there's a lot of experience, certainly with the original Wobenzym and Wobenzym N formulas, tremendous amount, but it tends to be older data, obviously. The more modern formula was the 3-ingredient formula of Wobenzym, what we have in North America as Wobenzym PS, and the overabundance of quality research and published research is on that formula that's a higher enzyme activity with only the 3 ingredients.
That was a great explanation. Thank you. The last question that we'll ask is, somebody was asking if the why the pork allergen was listed, and either you or I can answer that, Barry. But as these formulas do have animal source enzymes in them, they are sourced from pork or porcine. So that is why that allergen is listed on the labels. Trypsin can be sourced from bovine or pork, and is sourced from both. I believe, actually, if I'm not incorrect on this, both are a valid source and both are included and labeled. The requirement, it's actually a requirement from Canada to include pork as an allergen. And the question might be coming from someone who's not that familiar with that being the type of allergen that's typically labeled. It's certainly not one of the primary allergens, or that are thought of to be labeled on such products, but it's required in Canada as per the license. Okay. All right. We also got one more question in, and I think this is a really good one, so I'm going to ask it. As far as loading or dosing, is there a specific length of time to load up over the basic recommended dose? So is there a length of time, I think they're asking, is there a length of time before the blood levels become at a sufficient level that you'll see the benefits of these products?
Yeah, it's a difficult one. What you saw in the dose response data is that you actually, you do get a dose response. I can't comment. I don't know that I have the information, or at least I don't recall it, where that would max out, really. But, what we can say is from clinical use and experience that it's not uncommon with the lower potency Wobenzym N formula for it to be used longer term. And even though it's a loading dose at 12, 15 tablets a day, under doctor supervision, those who are used to using Wobenzym N in Europe, even higher doses are used for even extended periods of time to yield the benefit that the clinician might be looking for with the patient. So the increased dosing with the Wobenzym N or even the Wobenzym PS is not, I don't think in particular something we've studied directly, but not something that's brought forth any concerns really from a safety perspective. But from a practical perspective and efficacy, the convention would be to use the higher dosing of perhaps 12 tablets a day of Wobenzym PS for a few weeks to a few months before reducing back to the labeled dose from a maintenance perspective.
Okay, thank you, Barry. Those were all great answers and great questions. At this time, there are no more questions, and I will conclude the webinar. And everyone who has attended the webinar will get an email tomorrow with a link for the webinar recording, as well as a coupon code that they can use on the Douglaslabs.com website. If there are any other follow-up questions that you would like to ask, please direct those to the following email address. It is dlproductdevelopment, that's all one word, at atrium-innovations.com. Again, that's dlproductdevelopment at atrium-innovations.com. And we'll answer those questions within a 24-hour time period. So thank you all again. We appreciate your time, and thank you, Dr. Ritz, for presenting this fabulous webinar for us. Have a great day, everyone.